Fibroids. These are non-cancerous growths that occur in or on the uterus. Welcome to Focus on Health, a show on all matters health, wellness, and lifestyle. I am your host, Job Offender, and on today's episode, we are discussing fibroids alongside Dr. Boniface Musila, an obstetrician and gynecologist. But before we dive in, take a look at the health updates. So maybe, Doctor, you can introduce yourself to our audience.
My name is Dr. Boniface Musila, an obstetrician and gynecologist and a lecturer at Kenyatta University School of Health Sciences at the Department of Obstetrics and Gynecology. I also do clinical work in Nairobi at my clinic is called Portico Healthcare in Utawala along the Eastern Bypass. And I also consult in several hospitals within Nairobi, including AR Healthcare, Embakasi and Syokimau, and also Komarok Modern Hospital in Utawala.
Dr. What are fibroids?
Fibroids are abnormal, non-cancerous growths that arise from the womb or uterus. They mainly occur in women of reproductive age, and they may cause symptoms and signs during the life of that woman, and most of the times they will need to be managed.
Okay, so is there a reason in particular they arise in women of reproductive age?
Yeah, one of the reasons, there are several reasons why fibroids grow. There are a lot of theories on the causation. One is that they are much more common among African women. So black people or where there are black populations, fibroids are much more common compared to people of Caucasian origin or people with of Asian origin. Number two, they may be influenced by hormones. We know that before puberty, before the first period, before menarche, it is unusual for a woman to have fibroids. And after menopause, most of the fibroids shrink. Yeah, so they are associated with the female hormones, especially estrogen and progestin. We also know that fibroids tend to run in families, so there's a small genetic component. There's also an association between fibroids and fertility. The risk is higher. The chance that somebody has fibroids is much higher when they have fewer children and when they have had problems getting pregnant. We also know that women who have an early menarche, that means the early age at the first menstrual flow, and late menopause are more likely to have fibroids. Among other many other risk factors, including things like obesity, women who have bigger bodies are more likely to be diagnosed with the fibroids. There is some level of some influence from diet, habits, and even lack of exercise has been cited in some studies as part of the risk factors to predisposing a woman to getting fibroids.
Okay, so maybe, Doctor, you can emphasize on this or clarify. There is a lot of conversation on social media that says the more children you have, the less likely you're going to be having fibroids, or the earlier you have children, the less likely you're going to have fibroids. How true is this?
There is some truth to that. There is some truth to that because women who are struggling with fertility, with infertility, and those ones with lesser children are more likely to have fibroids. Now, technically, these may come into play because, of course, during pregnancy, the hormonal environment in the woman's body changes significantly. Other hormones take over in terms of controlling the pregnancy. And indeed, after pregnancy, the womb, the uterus, undergoes some changes which we call involution, in which case some cells may undergo some significant changes and the womb reduces in size. So the more children a woman has, the less the likelihood that they will be diagnosed with fibroids. So there is some truth in that. But then it is not like entirely, it does not entirely mean that if a woman does not have children, then they will definitely have fibroids. There are other contributing factors. Remember, saying that something is associated with another thing does not mean that if somebody has that association, they will definitely get that condition. So it doesn't mean that if somebody does not have children, they will definitely have fibroids. No, it is not true. But there is some association.
Okay, so we can go ahead and listen to the symptoms associated with fibroids.
So the symptoms are categorized broadly into three. One, these are symptoms that affect the flow of menses. We call it abnormal uterine bleeding. Number two, the other group of symptoms are associated with the mass effect of the fibroids, right? And number three, this category of symptoms are associated with the reproductive dysfunction. So starting with the first group of symptoms that affect the menstrual flow, we find that in women who have symptomatic fibroids, and I've called them symptomatic fibroid because a huge percentage of women with fibroids have no idea that they have them. They have absolutely no idea, all right, because they are asymptomatic. The fibroids are discovered coincidentally when they go get examined for other problems. But for those with symptoms, and it's just a small number, maybe even less than half of women with fibroids will have symptoms. So these symptoms, especially the ones that are affecting the menstrual flow, they are much more commoner than the rest. And the common symptoms is that they will have a heavy flow during periods and a prolonged flow. So how do we quantify a heavy flow? So somebody will notice that like when they were younger, they had, like at the peak of their period, maybe day 1 or day 2, they used to use 3 or 4 pads. They never used to use any tampons, and then they realized that with time, they are having to use more pads than usual, and sometimes they may even use a tampon combined with a pad so as to contain the flow. Yeah, they may also notice that previously they were not passing clots during periods, but then they start passing, big clots during periods. And sometimes somebody may notice that their pattern of bleeding, maybe the flow was between 2 days and 4 days. 4th, 5th day, it's over. But then over time, they are bleeding for more days. So that is prolonged flow. Yeah. Any menses that lasts more than 7 days is abnormal and it needs to be investigated. So anything that goes out of the ordinary, maybe the periods were for 5 days, then you start noticing that nowadays I'm getting periods for 6 days, for 7 days, day 8, day 9, day 10, the periods have not ended. It means you need to be investigated, and there's a chance that you could have periods. Now, that is the normal pattern of bleeding, dysfunction, or menstrual dysfunction, or abnormal uterine bleeding because of fibroids. There are other patterns of abnormal uterine bleeding that need to be investigated, and people should not assume that they are being caused by fibroids. We are talking about intermenstrual bleeding. All right. Remember, menstrual bleeding is cyclical. Once you are done with your menses, you should not bleed in between at the time of ovulation until you see your next menses when it is due. So if there is some bleeding that is unexpected, like in the middle of the cycle, that needs to be investigated because it could mean that there is a more serious problem. If there is bleeding after intercourse, yeah, that is serious, and we need to rule out things like cervical cancer. So that should be investigated, all right? Yeah, because does not fall within the normal pattern of bleeding, abdominal bleeding, uterine bleeding because of fibroids. So apart from abnormal uterine bleeding, fibroids may also cause mass effects. So ordinarily, the womb is located in the pelvis. But because of these abnormal masses, the womb may grow. And as it grows, it may put pressure on the bladder. It may put pressure on the rectum, because these are pelvic organs. So people may notice that sometimes they may have a frequent urination, and they may have constipation. And then as the womb grows, they may notice that they have a swelling of or a distension of the abdomen. Now, most women may assume that that distension is either because of they are becoming fat or because they have gas, all right? So some of them may ignore that swelling until it is too big, all right? And it tends to be very gradual. People may not notice. But when the mass is big, then the pressure on the rectum may cause constipation. Sometimes it can cause a bit of pelvic congestion, a bit of pelvic discomfort and pain, which sometimes may be cyclical. It may worsen period pain. This pressure also may happen to other pelvic organs like the ureters, and this may end up with a bit of pelvic dysfunction, among others. The other group of symptoms may have something to do with the fertility problems, all right? So fibroids may not necessarily per se cause infertility, and indeed women with fibroids may get pregnant, continue with the pregnancy normally, and even have vaginal birth or even a cesarean section because of other problems. However, depending on where the fibroids are sitting inside the womb, they may cause miscarriages during pregnancy. If they encroach on the opening of the fallopian tubes, they may cause issues with conception. During pregnancy, because they may grow together with the womb, or they may undergo some changes, which we call technically degeneration, it may cause severe pains during periods, and during pregnancy, and that will need to be managed. Remember, the location of the fibroids may be associated with the symptoms. So those ones that encroach into the cavity of the womb are much more likely to cause symptoms related to abnormal uterine bleeding compared to those ones that grow towards the outer part of the womb. We call those subserous or subserosal fibroids.
We're taking a short commercial break. Don't touch that dial. We'll be right back. But before then, take a look at the Did You Know segment. Welcome back to Focus on Health. We're continuing the conversation on fibroids alongside Dr. Boniface Musila. Take a look. So you've mentioned that this condition tends to happen in women of reproductive age. However, most people associate fibroids with women who are in their 40s. Is this true? Can it happen in a 14-year-old?
Yes, fibroids can happen in the whole spectrum of the reproductive age group of women. Indeed, the youngest woman I've seen with fibroids was 20 years old. So it can even happen in younger women. Yeah, of course, the risk is higher. The chance of somebody being diagnosed with fibroids is higher in the older age group, but we need to debunk that myth that young people cannot get fibroids. So it is possible that young people can be diagnosed with fibroids. It can happen. Okay,
so what is the management for fibroids?
So the management for fibroids depends on many factors. It depends on, one, the symptomatology, the symptoms that the woman have. And I say the majority of women with fibroids do not have symptoms. They're just okay. The fibroids are discovered coincidentally. So for those ones with the symptoms, they will need to be managed. All right. Number two, it will also depend on the goal of the woman. Now, for younger women with fibroids, the goal may be just to relieve the symptoms, whether it's a heavy menstrual flow, whether it is pain and discomfort, whether it's fertility issues. In older women, you may find that they are done with childbearing, so probably in their management, fertility will not be a consideration because they have had their desired family size. And of course, management will also depend on the availability of treatment options. So at this point, I'd like to say that being diagnosed with fibroids does not automatically mean that somebody will have to undergo surgery. Surgery is just one of the components of management, and in fact, most of the times, we may not even reach the level of doing surgery. So there are options for management, okay? Number two, there are a lot of people, especially in Kenya, who claim that they have cures for fibroids. Either these cures may use traditional medicine or some herbs that people sell to women, promising them that the fibroids will just melt. To be honest, if there was such a cure or a treatment, it will be available in hospitals. All right? So don't waste money and time pursuing cures that are being propagated by people who have not been trained, and it has not been researched adequately. So those are just con artists, and they will just take your money and leave you with your fibroids. Now back to the main management frontiers. So management can either be medical, meaning that we use medicines to manage the fibroids. Management could also be surgical, means we do some surgical procedures to manage the fibroids. And there are some newer forms of management that are there that they are not completely medical or surgical. So like a combination of both. So when it comes to medical management, this is geared towards managing the symptoms. So we are talking about the symptoms of abnormal uterine bleeding, that is a heavy and prolonged menstrual flow. So we have some hormonal medications that help in modulating the cycles. So we have the combined estrogen progestin pills, which modulate the cycles, and they make the menstrual flow to be less in terms of amount and the presence of clots. And sometimes, especially if that pill is taken continuously, it may abolish the periods for some time, and that will give the body time to recover. So apart from using the combined estrogen progestin pills, we can also use progestin-only preparations. These include injections, and when the womb is exposed to continuous progestin, that may affect the growth of the fibroids, and also, but more importantly, it usually controls the symptoms of a heavy menstrual flow, but not as effective as a combined estrogen progestin preparation. So apart from that, we can use an hormonal medications called tranexamic acid, which helps reducing the flow. This one is taken cyclically at the time of the flow. And how does it work? So naturally, when there is bleeding, clots form to plug the blood vessels where the bleeding is coming from. So this medication works on the clots to make them a bit stronger and to plug those blood vessels and allow healing to happen. Remember, this medication does not make the body to form clots. So don't fear taking this medication thinking that it will cause blood clots. So it won't. It's very good when it comes to controlling a heavy flow. So apart from tranexamic acid, we have also used the non-steroidal anti-inflammatory medications that are used to control the pain, and they play a role in controlling the bleeding. There's another preparation called the tamsulet, which works in other ways to control bleeding. When it comes to also the other medical modalities, we have hormones, hormonal preparation that cause an artificial menopause. We are talking about the gonadotrophin releasing hormone agonists. A good example is goserelin, or there are brands like Luprolide or Zoladex, which causes an artificial or a medically induced menopause, and therefore it cuts the bleeding. But remember, with time, that bleeding will resume, as the cycles will resume, especially in younger women. So mainly, it is offered when we are preparing for surgery, when we want the blood level to go up, or those women who are close to menopause, meaning that we're just buying time so that menopause can come. And once menopause comes, then we know that the fibroids will shrink because they are no longer now exposed to the estrogen and progestins. So apart from these medications, there are other newer forms of treatment before we go to surgery. We have what we call uterine fibroid embolization. So what does this entail? It is a procedure that we do to identify the blood vessels that feed the fibroids. So we plug those blood vessels using some biochemical preparations, and we starve the fibroid of blood and nutrients. So what happens next is that the fibroid dies and it stops to grow and it shrinks. And that treatment is available in Kenya. So don't be told that we can only do surgery. No. Apart from uterine fibroid embolization, there's a newer treatment that is not yet available in the country. It's called high intensity focused ultrasound, or HIFU in full. The acronym is HIFU. It's much more common in the Far East, especially in China. So we use we use ultrasound waves, but we concentrate the ultrasound waves on the fibroid, and this causes some burning of the fibroids without burning the skin. And the fibroids, once they are burned, they shrink. All right. There's also some experimental treatment which is similar to that, which uses magnetic resonance imaging guided ultrasound. So we locate the fibroids using magnetic resonance imaging, and we focus the ultrasound to burn the fibroids. So those are options that are not necessarily surgical. So apart from that, then when it comes to surgery, surgery is either myomectomy, meaning that we remove the fibroids themselves from the womb, and also a hysterectomy means that we remove the womb. But removing the womb is usually the treatment of the last resort. Like when everything else has failed, then that is when now we'll probably recommend removal of the womb or hysterectomy. Now, removing of the fibroids, myomectomy has 3 approaches. One of the approaches is hysteroscopy, especially if the fibroids are sitting like in the cavity of the womb. Yeah, so we insert small cameras into the womb, we identify those fibroids, and those ones are the ones that are more likely to cause the symptoms of a heavy menstrual flow. So we do myomectomy, but through the cavity of the womb, that is hysteroscopic resection. Occasionally also we can do laparoscopic myomectomy, meaning that we go minimal access. We access the uterus through some small keyhole cuts within the abdomen, and then we remove the fibroids and we allow the womb to heal. Now, if the fibroids are too big, then that means we will have now to open the abdomen, like the way we do it to deliver the baby, like a cesarean section. Of course, depending on the size, then we remove the fibroids. But we usually do this as a fertility sparing treatment for those women who still want to keep their womb. Remember, the womb is also very important. The cervix, which is part of the womb, provides part of the pelvic support. And, we do not endeavor to remove the womb like when it is not necessary. Okay? Yeah, but if all these treatments fail, then we usually recommend hysterectomy, which is removal of the womb. Now, hysterectomy can be done in an open way, meaning now we cut like the way we do for cesarean section. We cut open, then we remove the womb. It's a major surgical procedure. Occasionally, we can do laparoscopic assisted hysterectomy, so we remove the womb using minimal access keyhole surgery. And sometimes, if the womb is smaller, we can do a vaginal hysterectomy, remove it through the birth canal without necessarily having cuts on the abdomen.
Okay, so one major concern is if the fibroids can become cancerous, can they?
Ordinarily, fibroids cannot become cancerous, but we have a rare cancer called leiomyosarcoma, right? Which it is really not the fibroids which are transforming or changing into cancer, but rather it is a cancer that is affecting the muscles of the womb that starts as cancer from the beginning. And clinically, when we are examining these patients and when they are investigating them, there are several things we check so that we ensure that we are not dealing with the leiomyosarcoma, which is a cancer. Definitely, fibroids which are benign are much more commoner compared to leiomyosarcoma. Yeah, but they do not transform into cancer.
Very detailed conversation we've just had, and just as Dr. Boniface Musila has emphasized, fibroids can occur at any age within the woman's reproductive phase. I have been your host, Bofenda, and until next time, stay safe, stay healthy, and live with the Healthy You segment.